Thanks for having me today. My name is Sungjae Kim. I'm a postdoc fellow at Broad Institute and Dana-Farber Cancer Institute in Boston. Today, I'll be presenting about the MGIP. So our team recently identified very low level of monoclonal protein using a highly sensitive mass spectrometry. This was below the conventional detection level of 0.2 gram per liter that we use in ASPEP and immunofixation. And we named this state as a MGIP, monoclonal gammopathy of indeterminate potential. And after we found this, we had a key question to ask. Is MGIP just temporarily, or does it represent the earliest stage of the myeloma? So what we did is, firstly, we used a PLCO cohort, which is a nationwide cohort. We select those individuals who later developed myeloma and match individuals who did not but had MGUS. So what we found is, not surprisingly, most of them had MGUS, but 37 progressors, they had MGIP at any serum samples, and these MGIPs were either persist or increased to the MGUS level mostly. So that was an interesting thing we found. And next, we looked into the monoclonal proteins dynamics toward the myeloma diagnosis. And what we found was there was a very interesting pattern we call shifting dominance, where multiple M proteins appear and disappear and impede over time. And then we also looked at those M protein at the MGIP level and growing to the MGUS level. And we found that interesting that in progressors, they had higher growing potential compared to those in non-progressors. And also, those are exclusively IgG and IgA in non-progressors, while in non-progressors, like 30% was IgM. So there's a differences in isotype distribution. And next, we used a single-cell sequencing using the independent cohort. And we found biological evidence that MGIP can be derived from clonal plasma cell or B-cell population with early malignant features. Our findings suggest that the MGIP is not biologically trivial. I think MGIP represent the earliest identifiable stage of the hematological malignancies. And of course, we need to further investigate whether this MGIP has risk of progression to myeloma or any other hematological malignancy in general population. But I think this has very important implication for early detection and patient monitoring and better risk stratification.
If our videos have helped you in any way and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.